You're very welcome to join us here this evening in St Eugene's Cathedral Hall in Derry. This evening, the first Monday of the Lenten season 2021. We're beginning the first of 6 COVID conversations. Opportunities to have conversations, dialogues with very interesting people from the life of our wider community on a whole range of aspects of life. This evening we have Dr Rose Sharkey, the clinical lead for respiratory care in Altnagelvin Hospital, a huge hospital here and one which in the respiratory department carried a large part of the responsibility and the burden for people who were affected by symptoms of COVID. So, Kate Bela-Falcher.
Thank you, Michael.
You're very welcome here. Rose, you've come to Derry, which is not all that far geographically, I suppose, from your home in northwest Donegal and Falcarra, but how did you end up taking up medicine? What was your journey? How was that sense of interest in medicine? How did it start?
Since I've been expecting to go look back over my career, I've been thinking the last few weeks about how it actually has gone from Falcarra to here, and it's been a very kind of twisty, turny way. But I think God started me here and He's pointed me there, and I've taken the turns, but He's led along the way. So, and that's a big part of what I believe. So, because I was meant to do this. So, Falcarra, a small village in northwest Donegal, I once described it as a town to a friend who just passed through it, and she accused me of having delusions of grandeur. So, basically, it is small, but I grew up there. A big family on both my parents' side, but there were 5 of us, and again, 14 in my father's family, 8 in my mother's side, and they had to leave school early with limited education to go and earn and put food on the table. So basically then they came back to Falcarra, and education-wise I didn't really get stimulated in relation to education until I went to Derry Connor School in Skull Crux na Neve, and Muncher there was Sean O'Gallagher, who was way ahead of his time. I left that national school with a level of maths, Irish, English that I was still using in my Leaving Cert exams, which is equivalent to A-levels 5 years later. So I'm a real big influence on my education. Education was very important to my mother, especially for the girls, and so they spent money to actually send us to Derry Connor School, which was 5 miles away on a bus, which meant paying money. So that was because there was no real third level education in my family at all, definitely no medicine. So then I went to secondary school in Falcarra, PCC, and I did well there. And then when it came to deciding coming here, Leaving Cert, what career, in those days it was literally teaching, solicitor or medicine. And so I spoke to a few teachers, and they said, what do you like, what are you interested in, what are you good at? And I said, science, physics, chemistry. And they said, well, the options are science teacher, doctor or vet. Now I know I do not have the patience for teaching. I knew that at that stage. So that was very quickly put aside. And then my mother decided, listen, there are very few jobs for vets in Donegal. If you're going to be coming home, you need to go the medicine route, because there are more jobs for doctors. So I ended up putting medicine down, and as everyone did in that area, Galway number 1 and Dublin 2nd. So that was fine. I went off and continued to study. My mother then found out that the bus service to Galway was once a week, and the bus service to Dublin was every day. So she basically said, listen, you're going to Dublin. If you get homesick, you need to hop on a bus and come straight home. You can't wait till the end of the week. I go to the career teacher and say, listen, what can I do here? There's nothing you can do. You can't change your first option. If you get your first option, Galway, you have to take it. But here, there's a brochure there, the Royal College of Surgeons, Stephen's Green, Dublin. You may as well do the entrance exam for that. So basically, when September came, the results came out, I was offered Galway number 1 or the Royal College of Surgeons, and I ended up in Dublin purely based on the bus service from Donegal. So if you wonder how your life can lead, that literally led me then to Dublin. And I was in a class with 150, third developing country, third developed country, and a third Irish, basically. So you had a mixture of all religions, Muslim, Jewish, Christian, the lot, Hindu, they were all there. And this is me out of Donegal for the first time. No, well, not for the first time, but out of Donegal on my own for the first time. And I remember coming out at lunchtime and leaving the main doors, and the builder was on his overalls upstairs painting away. The builder, or the painter was, and he shouted down, "Cheer up, love, it might never happen." I just looked up and said, "Yes, it has." So this was my first kind of day in the College of Surgeons.
So you were coming from a very monocultural Falcarra to a very multicultural Dublin.
A non-Caucasian in Falcarra in those days would have stopped the traffic, so definitely it was very, very different going there. And I didn't really, we didn't know any better. I just got a bed set, and I spent the next 6 years on my own in a bed set, but made really good friends. And just basically it developed on.
And that was a challenge, I imagine, for you to say, well, what do I believe, or what is important to me, or what values do I stand for, and all of those things.
If you look back, I did 6 years there on my own, and then later working on my own. I went to Australia for a year on my own. I came back to Edinburgh on my own, and the one thing that continues along there was it was always faith. That was the constant friend. Whereas, you're a long way from home. You have to turn to something. I always found the local church. I always was there at all the services. But as the years have gone on, it's gone from a structured belief on, you could do all the services, you do all the formal things, to more personal relationship. And that's probably the big change that's happened really in the last 5 to 10 years. You kind of focus on your career, you get your prayer said, you could study, you forget about everything until maybe night time you say another prayer. Whereas now I've incorporated my belief more into the everyday, and maybe even more so in the last year with everything going on. So that's really important change.
So let's come to, say, 10, 12 months ago when the pandemic hit. I imagine there were huge pressures on all of you working in the hospital, and that must have challenged all of your routines and maybe even challenged your faith as well.
If you imagine back to March, the images coming out of Italy, they were so frightening. We didn't know what was ahead of us. We didn't know too much about this virus. And, with medicine, it's very much, you've got a pneumonia, you've got a diagnosis, you've got a set of tests, you get a treatment, and you go home. This virus was very different because we didn't actually know much about it. Now is completely different. We have known so much, and we've treated so much better. But back then, it was waiting for it. The waiting was the worst. You've seen Italy, and you just say, oh my gosh, is that coming here? And the waiting, once you were in it, it was actually better. But remember, at that stage, there was a lot of worry around PPE. Was there enough of it? Were we wearing the right PPE? And I still remember back to the very first patient we had. And nurses came on that morning, and that was fine. The ward opened, COVID ward opened that evening, and the nurses who were coming on for night duty were told, you're going to the COVID ward. They didn't blink an eyelid. Yes, off you go. And this is people who've come from home where they've seen TV images of what was going on, but they were going to do their job. So, episodes like that makes you actually realise how amazing some people are and how they've actually handled the past year. PPE now is second nature to us. It's absolutely so much more. We do it without thinking, but back then you were literally counting, have I got everything on? And you supported each other. Don't go in there, you've forgotten your visor or whatever. Everyone pulled together. So that was March, and as time has gone on then, we've got better at managing it. And I think the other thing that was tough over the lockdown was the visiting policy, relatives not getting in to visit as much as they would have normally. And as a result of that, there were a lot more tougher conversations over the phone and tougher conversations with patients. And, initially in March, you would literally stand at the bottom of the bed in your whole gear. Hello, I'm Dr. Sharkey. You were so frightened to go too near to a certain degree. And as time has gone on, you just got more relaxed about it. It's just the unknown.
And I suppose all of that reveals, both for the doctors, the medical staff, nursing staff, and for the patients, how complex we are as human beings. We're not just pieces of plumbing that you can fix. There's the emotional needs, there's the reassurance that people need. And I suppose the importance of faith for many people and the reassurance that can give.
Yeah, I think in general for me, it's very important that I try and touch, whether it's the hand, even with gloved hands, just touch the patient. And growing up, one of the most comforting things I ever received as a child from parent was, the hand on the eyebrow just to check the temperatures. It was a natural thing. That's what I do with patients too. Those kind of touchy, because a lot of these patients were elderly. They were completely isolated, and it was very frightening. And a lot of them knew COVID. They knew the potential and the risk of death with COVID. So to have that and to try and get someone, comfort someone with those in these periods whenever the family couldn't get in. So you just seen everyone just show so much compassion, so much love. It's not a question that rolls off my tongue, but so much love, so much respect to these patients. So in the middle of all of that, faith, God, it was all there every day. It wasn't in words, it was mainly in actions. And to me, a lot of my faith doesn't come down to the words. It's doing, it's what you actually do. And you try and actually show compassion to a patient, and hopefully a young doctor or a medical student, whoever's there, will actually pick up on that. They will learn the clinical stuff, they will learn the numerous causes of pneumonia or whatever, but the simple compassion, that practice needs to keep going, and it can't become impersonal. So hopefully that part of it is going to be taught to the actual next generation of doctors coming through.
I remember someone saying, teachers don't teach subjects, they teach people.
Yeah,
they teach
absolutely,
pupils.
absolutely.
You don't deal with illnesses, you deal with people who happen to have an illness.
Yeah, exactly. And I think also, with Anne Fried and a few other folk very early on, we knew the chaplaincy service was going to be really important, because that's the nature of the population who were in there. But you can't predict who will always want the chaplaincy service, but they should be asked. And most of the time we made a great effort to get the chaplain in, or to set up the FaceTime so they could do these services over the phone. Excuse me.
I guess you wouldn't have an awful lot of sympathy for those who say it's only a bad flu. What's all the fuss about? Clearly, COVID has had an enormous effect on many, many people.
I couldn't imagine to not being there if a loved one was dying, and there's going to be a lot of people who are going to find it really difficult to recover from that. And all I can say here tonight is to reassure anyone who lost someone in Altnagelvin Hospital in the COVID wards is they were looked after with love, compassion, dignity, and I can reassure them 100% of that. Your families may not have been there, but I tell you, I've seen the team, nurses, doctors, cleaners, porters, everyone do their best and actually understand the actual worry that families were going through. There was hours on the phones talking to family members, and then you would get off the phone, and now I would just say, God, please look after them, comfort them. And so that's my faith integrated into the practice. A year ago it would have been faith, do the mass, prayers, into work, nothing, and then evening time, night prayers, and that's it. Now it's very much on the way to breaking bad news. You're just saying, Lord, give me a hand here, I need to get this right, or look after them, they're really struggling. So all of that is much more a personal kind of best friend, or whatever you want to call it, someone who's actually walking alongside you and actually helping you to get through the day. And that's what, to me, faith has developed. Yeah. It's not compartmentalized as much as it would have been in the past.
Okay. Obviously, the vaccine is very important in terms of getting this under some sort of level of control. Yeah. You certainly wouldn't have any hesitation to encourage people to get the vaccination.
Like my mum is having her vaccine in Donal on Friday, and I'm so relieved. Absolutely, and she's always refused to take the flu vaccine for me, but she is delighted to be getting the COVID vaccine, and I think that speaks for itself. Especially for older patients, we need to get in there. We need the common touch. We need the hugs. We need the actual in the right time to do it. But we need to get that step, and the best way to get there as quick and as safely as we can is by taking the vaccine itself, because we are not people that can't survive without each other. And I think that's because I would be a hugger, I would be someone who it's a feely touchy person and a joker and that. So to me, that's part is really important. And even I would, to see someone in front of you upset, the most natural thing in the world for me is to get the hand or to hug them or whatever. To not be able to do that, literally, it was, tough. That's literally because, as I said, it's just the most natural thing for me is to actually try and comfort someone, and that part wasn't possible. And like, everyone is going through the same kind of situation, whether you can't see your mum or dad or whatever. It's all very tough. But yes, I would be advocating the vaccine.
Yeah, good. Obviously, what I'm hearing is somebody who's passionate about your medical career, and for whom faith has become increasingly important in the COVID context. Because there are some young people who say, look, you must choose either religion or science. And clearly for you, that's not...
No. I'm very comfortable with both hats on. And I think if you're going to treat a human being, you do it holistically. You've got your evidence-based medicine, and definitely you have to have the actual practice of taking their faith into account too. And even if they don't believe, if the situation arises, and to me, I'm always open to talk about it. Nothing is ever forced on them. But to me, if someone says to me something like, you seem very happy with life and that, well, I said, it's the Lord above that's doing it for me. I don't try and hide that at all, and but I wouldn't enforce it on anyone. But I think to completely and best treat someone and manage a patient is a mixture of the science and actually take their faith into account. Because at the end of the day, I was passing through ED there 2 Saturdays ago. There was this little lady waiting to go home, and she was saying her prayers. I went over to her. I said, "You saying your prayers, Daddy?" She said, "Aye." And she just grabbed my hand. I had the gloves on. She just grabbed my hand. She says, "Do you know, at the end of the day, that's all we have, isn't it? Love." And I said, "Yes, you're absolutely right. That's all we have."
You were one of the medical people who, on Thursday evenings in the month of May last year, rather than asking us to stand out and clap the medical people at 8, a number of you came in and said, we would like to lead the rosary here at 8 on a Thursday evening, because we need prayers even more than we need claps.
Yeah.
I was very struck by that. Where did that idea come from?
I think at the end of the day, a lot of my colleagues and myself, we're very uncomfortable with appreciation. We're very comfortable with the claps, and to me, very much appreciated, because there was a lot of gifts and that given in the last year. People have been really generous, but because of what I believe and very much believe, and it's got stronger as the years have gone by. Prayer is, to me, you get to a stage in managing something that you have to hand it over. And basically at that stage, probably in the middle of the worst part of it all, listen, we need help here. And the most natural thing to do in that situation is to turn to God and and the Virgin Mary, and just basically say, rosary, yes, absolutely. And so prayers is a way, please help here, and ultimately God will have the last say, not COVID.
You do your best.
Exactly.
You work as if everything depended on you, and pray as if everything depended on God.
Exactly.
And then you can let someone go if, for some reason or other,
exactly,
God's
you've done
calling
the
them.
best. Absolutely. No, completely agree.
And families will be reassured, obviously. So would you encourage young people to consider working in the medical, nursing, ancillary professions?
It is tough. It's very different to what I did in my day, starting off. But I think the right person has to go in. I think, I still see it as a vocation. I don't think it's as much, like a lot of these now, is not as much a vocation. I still see it as a vocation. And if you look at the team we work with, it's a vocation to them. There was never a 9-to-5 element to the last 20 years working in Altnagelvin. It was always there until you're needed, until everything is sorted. And it was weekends. Like Jared Daly was there when I arrived, and Jared was doing weekends along with Ken Moles. When nowadays people have to get paid to go on, whereas he was doing it, and that was a practice we've continued on before, because it's people don't get sick from Monday to Friday; they get sick 7 days a week. So to me, I wouldn't have wanted to do anything else. I've loved it from the very first day I saw a patient in Beaumont Hospital in Dublin. It's been an absolute, it's had its ups and downs, but I wouldn't change it for anything. And yes, I would encourage people to consider it, but the right person has to consider it, and you need to be passionate about it, because it's not a 9-to-5 post.
And you have to have a love for your patients, is what I'm
absolutely.
hearing you say. You could be great at the plumbing, but unless you have that gentle touch and the touch of the hand or the forehead.
Exactly. When my first 2 minutes with every patient is, who's at home? There's a joke, and just to get them relaxed. And then I was always told 90% of the diagnosis will be made on history. So if you get someone relaxed and you give them your story, you don't need a scan, you don't need a fancy test. You'll get a diagnosis if you listen. And that's another big part of medicine that is gone. Scan first and then talk to them. Yeah. Talk to them first, and that will direct you. So no, yes, as I said, I've loved every minute of my career.
That's marvellous. Well, thank you very much for telling us your story.
Thank you. It's 20 minutes up already?
20 minutes as well up at this stage. Yeah, all the way from Falcara via Dublin and Australia and Scotland back to Altnagelvin Hospital here.
And back to Falcara in the end.
And back to Falcara to Gerra here, Hal.
That's where I'll end up.
Very good. Thank you very much for sharing your own story. Thanks very much too for being so open about your own faith and how important that is to you, and how important recognising that may be for patients who are in front of you. Thank you very much to Dr Rose Sharkey for sharing her journey. Next Tuesday evening, same time, we hope to have someone speaking about homelessness, especially homelessness for young people during the context of this COVID pandemic here in the city of Derry. Thank you for being with us here this evening. I hope you got something out of it. I think you can read it again, you can listen to it again, can you, on the Cathedral website or on Facebook. And please God, you can join us again next week. Can we say a little prayer together?
Absolutely, yeah.
Glory be to the Father,
glory be to the Father,
and to the Son, and to the Holy Spirit, as it was in the beginning, is now, and ever shall be, world without end. Amen.
Amen. Amen.